What is AFib, also known as atrial fibrillation? It is when your heart is beating out of rhythm. Normally, your heart beats like a drum, nice and even. But with AFib, the heartbeat can get messy and uneven, sometimes too fast and sometimes too slow. It happens because the top part of your heart, which is called the atria, and the bottom part of your heart, which is called the ventricles, are not working together as they should. And some patients may experience symptoms associated with AFib, such as a fluttering or flip-flop feeling in the chest, a racing or pounding heartbeat, shortness of breath, like it's harder for you to talk, walk, and sometimes even breathe, feeling weak, tired, or lightheaded, sometimes even fainting. And all of these things matter because AFib can lead to blood clots, which may cause a stroke. AFib causes the heart to work harder, which can lead to heart failure. It can also affect your energy and your quality of life. So what are the common causes and triggers? High blood pressure, also known as hypertension, heart disease or valve problems, too much alcohol, and yes, too much caffeine, stress or sleep apnea, getting older, and even having a family history of irregular heartbeats. So what are your treatment options and medications for AFib? Well, the goal is to calm the heart, steady the rhythm, and prevent the clots. When it comes to AFib, treatment is not just important, it's life-changing. So some medications and or treatments to slow the heartbeat. Think of it like pressing the brake pedal on a car. These medications are called beta blockers, medications such as metoprolol, or calcium channel blockers, which are called cortisone. And sometimes they use a medication called digoxin, also known as lanoxin. These medications keep the heart from racing too fast and allow it to beat more steadily. Now, sometimes the heart needs to be guided back into a normal rhythm, and this can be done with medications called anti-arrhythmia medications, such as amiodarone, Tambacor, beta-pace, just to name a few. Or your healthcare provider can perform procedures called cardioversion. It's like hitting the reset button on the heart. These act like coaches, reminding the heart how to beat regular again. And then preventing the blood clots. Even if the rhythm isn't perfect, the doctors focus on preventing strokes with blood thinners called anticoagulants. And some included are Coumadin, which requires blood testing and diet monitoring, Eliquis, Xarelto, Pradaxa, just to name a few. These don't fix the heartbeat itself, but they keep the blood moving smoothly, like preventing water from clogging in a pipe. And if medications don't work, then doctors may use procedures like an ablation, burning or freezing the heart tissue that causes the irregular heartbeat, or a surgical procedure implanting a pacemaker, a small device to help regulate the heartbeat. Because every patient's situation is different, healthcare providers don't use a one-size-fits-all approach. Instead, they weigh several important factors before deciding which treatment path is safest and most effective for you. Your provider will take in consideration your age, your medical conditions, such as do you have diabetes, hypertension, kidney disease? Are you at risk for a stroke? And how severe are your symptoms? While your healthcare provider's medical plan, they usually choose the one that best fits your personal needs. And that's why daily follow-through is very important. That's where a health coach comes in, bridging the gap between medical guidance and everyday living. Managing AFib takes consistency, and this is where a health coach can make a huge difference, helping ensure medications are taken every day and as scheduled. Encouraging tracking of your pulse, your blood pressure, and your symptoms. Health coaches also provide education, such as explaining what medications do and which foods or habits to avoid, like leafy veggies with coumadin or energy drinks that can trigger palpitations. And last but not least, we provide encouragement, reducing fear, helping manage stress, and keeping motivation high. In short, a health coach translates medical instructions into daily lifestyle habits, making it easier to stay healthy and out of the hospital. And remember, for the time being, take your medications exactly as prescribed. And if you're having side effects, consult your healthcare provider before you just discontinue the medication. Check your pulse regularly to see if it feels steady or irregular. Eat heart-healthy foods, less salt, more vegetables, and limit your alcohol and caffeine intake. Stay active with gentle exercise like walking or biking. Prioritize your sleep and treat sleep apnea if you have it. Manage stress through prayer, deep breathing, or just quiet time. And call 911 if you ever have chest pain, feel like you're going to faint, or if you're having trouble breathing. Along with these practical steps, it's just as important to nurture your inner peace, because true heart health is not only physical, but also emotional and spiritual. When your heart feels out of rhythm, remember the words of Jesus in John 14:27. Peace I leave with you. My peace I give you. I do not give to you as the world gives. Do not let your hearts be troubled, and do not be afraid. AFib may sound frightening, but with the right care, lifestyle, and support, it is very manageable. Your heart doesn't have to control you. With wisdom, medical care, and the peace of God, you can live a full, strong, and purposeful life. I love to hear from you. If you have any questions about AFib or another health condition, please leave a comment or a question in the video description below. Your input helps shape the next discussion.